To Victoria, where authorities are trying to trace the movements of a Sydney man who became infected with COVID-19 after working in the state. Julia Bradley is live with us from Melbourne. Julia, this man visited a number of households during his trip.
Kieran, that's what health authorities in Victoria believe. As you say, working as a removalist. He was here in Victoria visiting a number of households. We believe he stayed overnight in the state on the last Thursday, before making his way to South Australia. He then returned to New South Wales on the Saturday. That's when he got that COVID test, which came back positive a day later. Our Health Minister, Martin Foley, says he expects to see more exposure sites added this afternoon to the health website, and he also expects that a number of people will be made to isolate.
The New South Wales Public Health team have provided us with initial high-level findings from their interview late last night regarding that person's movements in Victoria, and we are seeking, with the cooperation of our friends in New South Wales, access to the gentleman for further follow-up interviews right now.
Now, Kieran, this comes as Victoria shuts its border to New South Wales and the ACT by labelling both of those states red zones. Police resources are being significantly ramped up at the New South Wales-Victorian border. 350 officers are there at the moment, and they're conducting random patrols.
In the last 24 hours, issued or conducted 2,668 person checks, which is evidence that we're really active in our task and our mission to prevent people coming into Victoria, potentially lock down Victoria.
The good news is, though, that latest coronavirus case is not going to impact on our run of no new local infections. Because it's counted in the New South Wales figures, that means we've hit 12 days of no new local cases. Kieran?